The Breakfast Show 2020 on KBC English Service.
Today we are in studio with Sally Agallo, a very brave cancer warrior and also an awareness advocate. She's been telling us her story on how she has lived with various cancers and also HIV. This we are doing even as we are, of course, marking this awareness month, National Cervical Cancer Awareness Month, where we want you to get to know more about cancer, the screening as well, and even the vaccination. We'll come to that. Now, Sally.
Yes, please.
We're back to you. What are the common symptoms of cervical cancer? What are the red flags to actually watch out for?
Unusual vaginal discharge, abnormal vaginal bleeding. Sometimes your menstrual cycle is heavier and longer than usual. Discomfort while passing urine, loss of bladder control, and sometimes when you're having intercourse you experience some pain. And constantly fatigue, you have pelvic pain, unexplained weight loss, and leg pain. But I must say that this could also be anything else. So the best thing is to go for screening so that the doctors would confirm what exactly you're going through. So don't have these symptoms and start saying that, okay, Sally said this is this cervical cancer. So it's very important because symptoms would mean anything. Like now with COVID, you can have maybe malaria and you're having a flu, you're having a headache, and then you're having chest pains. So you can't just conclude it's COVID. It's very important that you go for this screening.
And talking about these symptoms, do they present themselves in the early stages of the condition?
Yes and no, because for my case I didn't have any symptoms, and still the virus was there. And yes, so we shouldn't ignore. So as soon as you have this kind of things that I've talked about, it's very important that you go and get checked, because these are red flags.
Okay. What are some of the risk factors that, will predispose one to cervical cancer?
The most common one is the HPV, the human papilloma virus, and so actually what we should be screening for is the HPV. So if you get that, then it's important that now you go further and now screen for the cervical cancer.
It takes, like 15 to 20 years to actually develop in a woman's body. So at what stage would these symptoms likely appear?
That's a tough question to answer, because our immune systems are different and people react differently to things. Like, again, if I go back to my story, I had HIV since 1999 and I was detected with cervical cancer in 2007, meaning that I was having the HPV for all this long. So it depends with individuals and our immune system.
What about the age factor? Is it a factor as well?
Yes, we are told that any woman in the reproductive age. So we are talking of 16, 35, 40, around there.
Okay. Does the use of tobacco and alcohol increase the chances of cervical cancer, or is this just one of those myths?
It is, but it is also said, but the percentage is very, very small. Very small. Yes.
Certain methods of contraception can cause cervical cancer. Is this factual?
It's not related with cancer. Because some people even say that the HPV is bad and they don't want to prevent, vaccinate their girls. So there's a lot of myths, but it's very important that people take their own individual responsibility and just get facts right.
Early treatment can prevent up to 80% of cervical cancer cases. What does this treatment involve, Sally?
One of the things is the screening first, and then now again, depending with the individual, you will discuss with your doctor and your surgeon on the treatment plan. And as I said, treatment for cervical cancer would be radiotherapy, chemotherapy, and surgery, like what I went through. But there's also what is called brachytherapy. It's just not very different from radiotherapy. But again, this has caused a lot of pain in women, because you find that their vaginal area really is affected and closes sometimes. And so women have had a lot of challenges. Of course, cancer treatment has been very harsh sometimes, but at the end of it, you thank God that you get better.
Okay.
Yes.
The Breakfast Show 2020 on KBC English Service.